What's coming next right now, I am really excited to bring up to the stage 4 panelists. We're going to have a special COVID panel today to really talk about and hone in on networks in times of crisis. As they're coming up, I'm going to set the stage for just a little bit of setting here. This is our launch into the problem zone. The problem zone of our design sprint is when we get to really deeply connect with the problems, especially those that might be related to networks and networks in times of crisis, but particularly around the future of networks. I'm just going to ask each of our panelists to make sure you turn on your camera and unmute your microphone. There you go, and now you'll pop up. So this problem zone time, the morning was when we got to ask those big questions and start that conversation. This is when we get to just really talk about the nitty gritty. What we want to do now is take the conversation from a high level to real work, real stuff that we're all dealing with each day. So here we go. And the first, our chance to do that is going to begin with this panel. We're going to have these 2 panels. And then we're going to start our exercises. So hang in there for some more good content. All right. So for anyone who's just joining, I'm Danielle Varda from Visible Network Labs and the University of Colorado, Denver. So our first panel is a really special group of people, each one playing a significant role in their communities and organizations in both response and recovery to COVID-19. We have with us today Pat Smith, who is the Chief Executive Director of Serve Denton in Texas, Dr. Kameron Hodgens, who is the CEO of the Schoenbaum Human Services Center, Heidi Ganahl, who is a CU Regent, the founder of the Fightback Foundation and the CEO of the She Factor, and Jill Hunsaker Ryan, who is the Executive Director of the Colorado Department of Public Health and Environment. So I'm not going to give you intros on each of them. I'm going to ask each of our panelists to introduce themselves, tell us who they are, about their organizations, and just a summary of how their work has looked over the last 8 weeks, or probably 3 months or longer for some, who have been preparing and responding to COVID. So I'm just going to go ahead around in the circle. Why don't I start with Heidi? You're just to the right of me on my screen. So take it away, Heidi. Oh, you just muted yourself.
Sorry. This is one of the things about the last 8 weeks is trying to get used to all the different technologies, but this platform is amazing. So thank you for having me, Danielle. Wow, there is so much to talk about. I'll try and keep it simple. On the University of Colorado side, as a regent, obviously higher ed has been turned on its head. So we are dealing with some crazy stuff there that I'm happy to dive into and talk to. But the network of other trustees, regents and other higher education leaders has been critical in helping us navigate a way forward and making sure that we're checking in constantly with other people that are in this situation and dealing with the issues that we deal with today. And then on the business front, I have Fightback Foundation, which is my the charity that I built to help and support social entrepreneurs. So that's a different kind of network. And the way that we're finding we can support entrepreneurs best right now is through discussion, live, like happy hours, just getting people to talk and to vent a little bit about what's going on and support each other in a really intimate way. And then finally, She Factor, which is a digital and live community for young women that are just launching their lives out of college typically. And we had just launched a big live event series for She Factor that we were hoping to do the rest of this year and had to pivot immediately to do strictly virtual events. And we're having a lot of success. We're hosting a big virtual graduation party for women college graduates around the country on May 28th. So I'll be able to tell you after that how that worked. But so much going on. Networks are incredibly important to keeping us sane right now and to keeping us on track. And I'm very excited to be here and hear from the other panelists as well.
Awesome. Thanks, Heidi. Let's skip over to Jill. And you're muted too.
Thank you for that. Hi, everyone. I'm really happy to be with you this afternoon. I am the Executive Director of the Colorado Department of Public Health and Environment. I am a member of the Governor's Cabinet. I was appointed in January 2019, so have been there a little over a year and a few months. But my background, my career, the last 25 years has been mainly in public health. And I ran a local public health agency in Eagle County, Colorado, where we did a lot of preparedness work. Of course, I don't think anything could prepare anyone really for COVID-19 and the way this virus behaves. For example, the asymptomatic nature of transmission makes it really hard to control, and some of our normal public health tools don't work as well given that. So we've been the lead state response agency in partnership and collaboration, though, with the Department of Public Safety, and have stood up what we call a unified command. So we're working very closely together with that state agency. Normally, our system is the Centers for Disease Control state public health system, and then in Colorado, we have local public health agencies that cover every county. With Department of Public Safety, they work with FEMA, and then they have emergency managers that cover every county. So we've all been working in partnership on this response. And I guess, the best way to describe it is just the complexity, the volume, and the speed at which we're trying to respond is just so far beyond what anyone's ever done. It's like having a hurricane or a wildfire, right, in all communities around the world at the same time. It's affected supply chains. It's created frustrations because, frankly, everybody's wondering, well, state government, why aren't you already ramped up in your areas of communication or testing or contact tracing or procurement? And it's really hard to ramp up systems on a dime or laboratory that didn't exist before. So I think that everybody's certainly working hard and rising to the occasion. But yeah, definitely, it's a new environment, even for those of us that have done emergency preparedness or response in the past. It's just nothing, I don't think, has challenged us to this degree.
Excellent. Thank you for that overview. I think in a position that all of us may not envy at the moment, but are grateful that someone is taking that on in leadership. Kameron, do you mind doing your intro, telling us a little bit about yourself and the networks that you are engaging in?
Sure. Good morning, good afternoon, wherever you are. I'm Kameron Hodgens. I'm the CEO of the Glasser Schoenbaum Human Services Center in Sarasota, Florida. That is about 55 miles south of Tampa. So we're on the west coast of Florida, just at the southern edge of the Tampa Bay area. So our campus is 30 years old. We have 14 buildings. We house 20 separate human service nonprofit agencies and about 46,000 square feet of air-conditioned space. And I am only the third CEO there in a 30-year history, which is pretty cool. And so with Sarasota was kind of settled in the 20s. We're not that old. And to have something that's 30 years old in a network system like this is a really wonderful thing and has proven its value, particularly right now in the COVID situation. How our network of human service organizations is working, from my perspective, there's just the very black and white things like what the space is doing right now, and are we closed, are we open, how are people staying safe? I have about every other week call with the executive directors about their comfort level. And for me, I think leading during this time is about comfort and empathy and trying to understand where everybody is on their level of fear and education and awareness of everything, and still trying to make the wheels turn and get people served. Speaking of people served in our community, our food banks are up 137% in delivery. I was on a call last week. An interesting statistic is domestic violence is up, but shelter visits are down. And I think it has to do with that communal living, like people are hesitant to go into a shelter because it's all shared space, right? So some interesting trends that we're seeing. I think I'm going to get more into that later, but that's right now activating also a big network. I was just mentioning right before we all jumped on to some folks in one of the rooms that Sarasota is a pretty small town, but there's a lot of wealth here from retired population and a lot of foundations. And so they're jumping on calls weekly, and it's really a blessing, because for the first time in a long time, they're actually working together to get resources to underserved populations. And they're really talking not only with each other, but with county representatives from sort of our region and with the communities who need the help. So I see a lot of silver linings here.
Awesome. Thank you, Kameron. Pat, let's hear from you next.
Hello, I'm Pat Smith. I'm the founder and CEO of Serve Denton. Serve Denton is an old idea that's been around 40 years, but was only really activated as an organization 8 years ago. We have a 5-acre campus, 48,000 square feet with 20 nonprofit agencies, all focused on health and human services. Early on, immediately we became a major hub for communication. I have a strong communication staff underneath me, and we quickly organized some daily calls with our internal partners on the property with the CEOs every day at lunch. And then on Tuesdays, we have a much larger call with now about 50 organizations, both government at the county as well as the city level, organizations outside of our property, as well as the school districts. And that's become a very powerful tool to help resource these very difficult situations. I think what government has found is, they have dollars, but how to mobilize those dollars often ends up coming through nonprofits. For example, rent assistance. Was just on a call on Friday with our county judge, and just like Kameron said, we're seeing visits to food pantries have gone are now about 300 to 500% greater than they were in February. And so the government has money, but they don't have food, and they can't really procure food very easily. And so that's where we as a network are working together to do that for them. And we're very encouraged by that partnership, and just seeing how people are leaving their hats and their agendas at the door and saying, let's figure out how to get this done. And Serve Denton has been a key element in just facilitating that conversation. I always like Kameron's analogy. We're Switzerland. We're that neutral ground where everyone can come. We have faith-based organizations working with government, which never would have happened in the past. And we're able to facilitate that. And sometimes we're the pass-through, and sometimes we're just the cheerleader.
Awesome. So what I hope that folks at home might have noticed here about this panel is that we really tried to think about the problems and the networks that might have been being activated around COVID at all kinds of levels. We know that there is very grassroots on the ground micro networks getting stood up. We know that state agencies and entire university systems are having to work on the fly right now. And I think what all of us are feeling is the impact of that. So whether we are at home and our kids are not at school, or we don't have our job right now, and that's leading to all of these questions. And I think we all have this real sense right now of like what just happened kind of feeling, and then also a really, really strong feeling also, I think, in this present moment of we just do not know what is coming next. It's a kind of almost a confusing phase. So I think it's really amazing to have your all's perspectives and these different kinds of, so you add a real systems lens. So I really want to encourage everyone at home to think, like, as one person is talking, how that there's a ripple effect across all of the different entities that are represented here. I have a series of questions for you all, and so I'm going to go around and ask them of you. If anyone else has comments on those questions, please feel free to jump in. This is our conversation together. But we're also just going to move forward that way. If anyone has questions from the audience, please put them in the Q&A. I'm going to go ahead and start with Jill. So Jill, I know that you have a real rich experience working in public health, and COVID-19 has stretched all of us to have to consider these unexpected consequences and pushing us to think outside the box and reach across sectors to understand the problems and consider solutions. In what ways have you both, in your personal experiences in public health and now professionally in your role in response, have had to think outside of typical public health and connect across boundaries, and outside of the public health silo?
Yeah, Danielle, thanks for the question. I think in two areas in particular. One, of course, we've needed hospitals as partners, and wow, they have really stepped up. And I'll tell you what, the cooperation between hospitals, and these are normally competing entities, has been tremendous. And they're meeting weekly, and they're meeting with our folks as well, and giving us visibility into things like their PPE levels, their ICU beds, metrics that we need to be able to plan on a statewide level. And then, I'll just comment about our partnership with the Department of Public Safety, and having to bring together two sister agencies to sit under a command structure and in the same facility, and how interesting that was, because you had two completely different cultures, right? You have public safety has under it the Colorado State Patrol, and it's a very command and control sort of agency, and they do emergency response like to wildfires and floods all the time. And then you have Department of Public Health and Environment, and we take our time on process and collaboration, and we're sort of less in the emergency response role. And so I think because everything is accelerated in this event, we went through the forming, storming, norming, performing really, really quickly. And I think although initially people were thinking in terms of turf, and I don't understand that culture, I think we all came to a point of gratitude, because as I mentioned, with the volume and with the speed and with complexity, partnerships are really a force multiplier. And that's, never more evident than in emergency response. So I think once we got over our own turf issues, we really started to have such gratitude for what the other organization could bring, and started to really form very warm relationships that just, I think, provided such a proportional or maybe even exponential value in our response. We've been meeting with each other at least twice daily since the response began, including on the weekends. I mean, everybody on this team's just been working pretty much since March 2nd. And so, just feel like in such a great place with a network we didn't really have before, and people that hadn't really worked together before.
Yeah, and just a really quick follow-up. Do you think that this might mean government may become more nimble? Will this be a learning lesson for how we can run government in everyday lives?
It's such a good question, probably because we've had to break a lot of the systems. We've had to break the normal processes just because we've required speed in our response. So think procurement, think HR, even communications, and, going through multiple layers of people having to look over documents and give their 2 cents and then approve. We've had to say we take that down to 1 or 2 levels of approval, and then we have to get the information out. So yeah, I think so. Cutting through the red tape, right?
Yeah, networks have a way of bringing new innovation in that disrupt, right? Make us feel like we might have an opportunity to do things a new way. Thank you. So I'm gonna move to Heidi for just a minute. I know Heidi in a few different ways as a business owner, and she's been a mentor to me in that regard, and through her foundation, and as a CU regent, as a member of the faculty at this university. It's been a privilege to watch her in her leadership. And so, Heidi, I know you have 2 very strong perspectives as a very successful a business owner and as a CU regent. So I'm going to try to tap in at 2 different times, those different things. So the first question for you, as a lot of us are experiencing either through our families or personally, colleges across the school and across the country and schools at all levels have really had to scramble to put logistics in place for quick closures. That had immediate, ongoing, and long-term implications for people and communities across the country. Can you talk us through a little of what that looked like from a leadership perspective in higher ed? And what are all the many factors that you had to work through in the early days, ongoing, and now for the future?
Oh my goodness, Danielle, it's been like drinking from a fire hose. And I'm sure Jill can relate to this. And when you're trying to get government agencies to work with higher ed, to work with parents and students and faculty. And it's just this incredibly complicated web of people engaged in the decision making. But ultimately, we had to really keep it student-centric and focus on what was best for the students, whether it was staying in the dorms if they didn't have anywhere to go or moving out of the dorms, and making sure that we were as transparent with information as possible with both parents, families, and students and the faculty. Because early on, it was so, it was just scary. We didn't know, what was going to happen. We didn't know how quickly we needed to move. So we had to make decisions based on worst case scenarios, and that's what we did. Moving students out of the dorms as quickly as possible, moving to online education as quickly as possible. Then we had to tackle all the things related to refunds. Did the students get refunds for their dorm fees or for the student fees that they pay around the rec center or RTD fees? And every day we were on calls making, pretty big decisions that normally we would take weeks or months to make, and we had to make them on the fly. And so I think we'll come out of this much more efficient, much more effective. I'm actually kind of excited to see what we innovate through this in learning and tools and creating what the future of education looks like. We were already working towards that, but we just had to accelerate it dramatically. And luckily, our president, Mark Kennedy, is an innovator. He's a very big thinker, and he was already working with some consulting companies on how we could take our whole platform to the next level. So we're just all having to just dig in, make decisions much more quickly, and really using a lot of instinct and gut decisions about what's right for our students. But keeping it student-centric, I think, is the most important thing we're doing in higher ed.
Excellent. Thanks so much. I'm going to come back to everyone with a second question if we have time. So Heidi, I'm going to come back with our questions around businesses opening and closing, which I think is such a crucial part of what's happening right now. Let me just move to Kameron and Pat for a moment. And I do this, it's kind of my way. I know Kameron and Pat because we worked together on a Robert Wood Johnson Foundation project, and what I've learned from them is the importance of networks and community on the ground, and the vital importance of having a Switzerland, a neutral entity inside the community that can help everyone navigate where to go. And when we met, you were doing that in normal times or before COVID times. And then I remember after COVID happened, we all got on the phone together to talk through how network science and network data could inform the work that you're doing now. And I was just completely floored by what you were in the middle of. I think it's almost a little bit of the hidden stuff that's happening behind the scenes to kind of make things go. So Kameron, my first question for you is really about families. At the core of your work is the family structure. And creating coordinated networks of care for families is one of your organization's key value propositions. So achieving that mission was challenging before COVID-19, as we know. How has the COVID-19 pandemic impacted families in Florida, especially as their lives were initially disrupted and ongoing? And what kinds of networks are you seeing being activated to support families in your communities?
So, every day hearing stories about what the agencies on the campus are doing to respond. We have an agency called Healthy Start Coalition of Sarasota County. And the executive director, of course, was home with her kids and getting phone calls like crazy about diapers, families needing diapers, because like toilet paper, diapers were sort of wiped off the shelves too. And without even thinking or really going through the logistics or even the legality or liability, she set up a distribution out of her garage, and people coming to her home at all hours of the day and night to pick up diapers. And, she was nervous, talked to her neighbors, made sure they knew what she was doing and it wasn't anything that was, illegal. And then her board members started to drop off diapers and the community started to drop off diapers. But what are you going to do? She had to be home with her kids. Her husband was working. And so to this day, she's still doing diapers. Oh, and formula, by the way, too, out of the garage, and kind of out of the goodness of her heart and just seeing a community need. Pat mentioned the food banks. We have every other week, we have a food bank mobile pantry on the campus that comes, and just the uptick in people needing food is tremendous. I mentioned a couple of silver linings here with the funders, but another one that I've been hearing about recently is virtual therapy attendance is up, both for actually, so obviously virtual attendance is up, right? But people coming for appointments is up too, because it's virtual. So especially in the addiction recovery arena and in family therapy, my providers on the campus that are in those spaces are saying they're having a lot of attendance and people showing up who were typically hard to get to come into the office are making it. So that's good. The flip side of that, obviously, is the tech divide. And if people have the technology that they need in their homes or in their, wherever they are to actually access the service, a lot of the foundations here are funding those kinds of needs for family organizations to make sure that their families have the tech that they need in their homes or wherever they're living to access services. I do see also the school boards in both Sarasota and Manatee counties being very, very engaged. Manatee County, which is just north of Sarasota County, quickly mobilized like 20 school buses outfitted with Wi-Fi hotspots so that their students could connect in underserved communities within a certain radius of those buses so that they could continue their education, as well as providing some computer support there too. And the schools are also very involved in food drop-off and food distribution locations. And of course now knee deep in planning how we're going to reopen for the fall. The other piece that a lot of families weren't ready for, and Heidi, this is in your neck of the woods, was the students coming home and the expense of getting them home and the expense of like a storage unit to store their stuff and how that was going to look, and did they have everything they need. So some of the agencies were giving cash support to these families to make sure their kids could get home safely with everything they had with them. Sarasota Community Foundation, or the proper name is the Community Foundation of Sarasota County, has a program called Season of Sharing, in which anybody in the community can contribute to. And then it goes out to families usually at $1,000 a clip. Well, they raised that to $1,800 for a 90-day period. And really, like Jill said, dropped a lot of the paperwork and the requirements for families to get to that money. And so that's going out very quickly and through a person on my staff. We're one of 6 fiscal agents in our county that distributes those funds. And that's been a real lifesaver to a lot of people. You've probably seen in the news that the Florida unemployment system is a nightmare. And so people are really in a bad way without their financial flow, obviously. And Florida is so heavy in recreation and tourism and hospitality. And those are the industries that have been hit the hardest. So the foundations and the funders, everybody's, calling, where can we give money? Where can we give money? And my mantra for the first few weeks of this, and probably still is cash needs to flow quickly into the hands of those that need it. Just cash, just get it out as fast as you can. And so they have really responded with that, not only directly where we can, but like Pat said, through the nonprofit networks too. So.
Yeah, you are really on the ground doing the work day to day. It's really humbling to know how much that impact that you all are having. I'm just sitting in my house doing network science stuff most days.
What you do is amazing. And Danielle, I just want to give props because kind of what I'm hearing from everybody and what your research showed us was trust and value is so important in these networks. And none of us could do any of this without trust and value. And from what Jill's saying about moving two entities that may not have worked together, you're building trust there, and you're also building value, and that will make things more efficient. And I know for Pat and I, that's really what helps our communities be more efficient.
Yeah. And another thing that I'm hearing and I'm seeing in some of the chat and stuff too is just that, big complex problems require innovation and out of the box thinking and kind of getting out of our comfort zones, even if that means you're in government or you are in private sector or nonprofit sector. So getting pushed together right now, I'm wondering if we're going to see more in common with each other in the end. I'm a little hopeful in that way, but in ways that we can make systems work better. Let me address this question to Pat. So Pat, I know as a shared space program, you have a broad range of organizations and people that you interact with frequently. I've heard you say a few times now that systems that we typically rely on are now fractured, making it increasingly difficult to provide those services. One area that I think some of us are seeing that brought to bear that we don't really know much about is in our public safety. And with public safety officers, we're seeing and hearing about upticks in reports of crime and reports of domestic violence. How are you supporting officers and public safety in getting out of their silos and leveraging resources in new ways? And how might that change how they do things in the future?
Thanks, Danielle. Yes, what we're seeing is, we've seen officers really become often mental health caseworkers or having to do counseling in very difficult situations, whether it's a domestic violence situation or someone who's dealing with anxiety and is acting out. And these are officers, I've participated in their training. They get 20 minutes in their course of becoming a police officer on mental health. And so what we're having to do now is mobilize our nonprofit agencies going out often with officers or being on call to intervene in that situation. As Kameron said, the domestic violence shelters are full. There's no more capacity in that system. We're even having to put them in a hotel, or they're just going to stay there because there's just no place to go and there's no way to subsist outside of the home. We have created a homeless outreach team. That's obviously a very vulnerable population from COVID, ability to resist COVID-19, sending them folks out with police officers doing physical mental health checks. I just got an email about 20 minutes ago. They're going to double the number of officers doing that. And we have 2 officers and 2 people from faith-based organizations going out together to do these outreach assessments. And they're doubling that just because there's so much demand. And we're going to see our homeless population increase. The Texas State Supreme Court just rescinded the restriction on evictions last week. So we're going to see evictions go up. And we have to prepare for that. That's a whole new dynamic that no one has ever anticipated. So when I talk about the old systems are in shambles and we're having to develop and innovate, this is one example. I can give you 3 or 4 others right off the top of my head.
Yeah, and Pat, just to expand on that a little bit, I know that in Denton, the faith-based community is really strong. We saw that in some of the research that we did with you. What other roles are faith-based community playing in some of this response, and how is Denton as a community leveraging all of these kind of different organizations working together?
Yeah, so in Denton County and generally in Texas, most of the support for the homeless community, human trafficking, food are coming out of faith-based organizations, whether they're actual churches or faith-based nonprofits. And so just had a call on Friday with the county judge, who's the executive over all the county, and how are we going to, the question is how do we increase the distribution of food and the supply of food, because food shortages are becoming an issue. And he's asking the question, well, so what are the constraints in the system? And it's refrigeration. High quality fruits and vegetables and protein are what families need, but most pantries have box goods. And so I literally have my property director today, we're calling it Project Cornucopia, to put in refrigeration at all of these food pantries that are little church food pantries, but that's it. That's where people know. And how do we boost their capacity to distribute that high quality food, assuming we can get it? We're working on another project to do that. So we're doing the program management. That's something that we do well. And then help the food pantries are busy just trying to keep doors open and get food going out the door. They don't have the time to figure out how to go get a walk-in cooler or freezer, get that contracted for and installed. And that's not something government's going to really do. Yeah.
That's amazing. It takes a lot of diversity, a large reach in a network to make all the parts come together. Let me ask just two more questions. A quick one for Ryan and Jill and Heidi, and then I'm going to open it up a little bit broader for the Q&As coming in. But Jill, I just have a quick question. I'm just insanely curious. I mean, we're all talking about contact tracing and how contact tracing has all this unknowns. It's just a huge question mark for us. But what is the network that you are having to think of right now to put in place to get some of these long-term recovery systems in place?
Yeah, it's a good question. So, in public health, the best way to control disease, if you're not going to just shut down society and have ongoingly high levels of social distancing, is to be able to detect the disease in people so they can isolate, and then to be able to contact trace their close contacts so those people can quarantine. And so we have to ramp up testing systems and contact tracing systems for quarantine on a statewide level. And the model for that is really using our local public health agencies, since they cover the entire state at a county systems level. And so what we've proposed to them is funding each county public health agency to partner with a healthcare entity to be able to provide free community testing so that we've reduced barriers for people to getting a test. And then once we know that, we have people testing positive, and this can be symptomatic or asymptomatic, and those people are given instructions about isolating, and they're given resources and support to do that successfully. If you're able to then contact trace, that's again a force multiplier, because you don't have to wait until their contacts develop symptoms after 5 days and get testing after 8 days, and then we get notified after 9 or 10 days. So we're able to control disease quicker. And to your point, I mean, it's just figuring out their networks of close contacts. We're not only going to do that with people, but as people have mentioned, innovation, using technology as well. So the first contact that someone who's been exposed might get might be through a text message that says, "We think you've been exposed. Here are the next steps." And in fact, we might use technology for people who we think are going to be highly successful in isolating or quarantining, and then using our epidemiology staff to do the case investigation or the contact tracers for people who are may need some extra support or guidance and need that personal contact.
Yeah, that's amazing. Networks have people, organizations, technology, right? Systems, beliefs, all of those things. Let me ask this last quick question for Heidi, because I want to capture this since you really have an expertise on this. We know that one of the most disruptive aspects of COVID-19 has been the closing of businesses across the country. There's almost no one who hasn't been impacted by this, either the lack of businesses to buy from, people who've lost their jobs, and entire companies that are closing their doors permanently. You've weathered all kinds of ups and downs as a successful business owner. What do you see as the ripple effect of that has happened for the future of business, and how that future might impact both business and people generally?
Well, Danielle, so I'm an entrepreneur, but so is my husband. And my husband has a couple restaurants here in Denver and has been, he's been on the front lines of dealing with this issue. He stayed open doing takeout and delivery, but I've really been involved in those conversations and hearing how it's impacting him on the front lines with his employees and his customers and his just general frame of mind, and dealing with the PPP loan and all the craziness around that. And then from my perspective, we took our company virtual and we're all working from home, and it's been a little bit easier than what he's dealing with on the restaurant side. But I think I'm the chair of the board for an organization called Job Creators Network, which is founded by Bernie Marcus, the founder of Home Depot. And we're kind of like the Small Business Chamber of Commerce, and it's a large organization. And so I'm very much on the front lines of what's happening in DC for small business owners. And the thing that I hear most is, they're very worried that people aren't going to feel comfortable coming back to work for a couple reasons. Number one, the fees they're getting from unemployment are more than what they'd make at work, the $600 extra. And then number two, they obviously don't want to get infected or get the virus and are worried about spreading it to their family. So I think that's going to affect whether we can restart the economy really quickly. Number two or three, I'm not sure which number I'm on, is just the mental health of entrepreneurs and small business owners. Everyone's terrified about, even if we go back to work right now, what if there's a second wave this fall and we have to revisit this whole situation? And are people going to have the stomach to really lock down again and close their businesses and go that route? My sense is no. So we're going to have to figure out some other options. So there's just so much fear and uncertainty. And what I would remind policymakers and people making these decisions from a government perspective is that no one wants customers and employees to be safe more than the entrepreneurs and the small business owners. These are like family to them. They care deeply about the people around them, whether they are customers or employees. And I think we can trust them to make good decisions in most cases. And there are outliers, but I think we can lean a little bit more that way than total control. And that's from my entrepreneur hat on. I know there's the public safety perspective that's very different. So I honor everything you guys are saying. And boy, you have the toughest job on the planet right now. So it's easy for me to say that. It's much harder for us to figure out the details of what that looks like.
Well, thank you. I'm going to close with just one question. I see a lot of questions coming in the Q&A, but I'm going to wrap them into this one. I think Jill might have to go. So Jill, if you drop off, thank you for your time. We know you are probably up to the minute needed, probably hands coming at you from every direction. So thank you for your time today. Last question for anyone who is hanging on. Is a network is made up of many different levels. They're full of power at different levels because there are big organizations, whole University of Colorado systems and health departments, and then the small nonprofit on the corner. And of course, at the root of most of the networks that we're working on are the people, the students, the families, the doctors, the responders, those people who are affected by all the decisions that are being made by people with power in the networks, basically. How are you all, and I'm just going to kind of open it, getting the input and feedback from the people in which your networks are affecting to make sure that there's voice in the network for these decisions as they go forward?
I think Heidi's mentioned it and Pat's mentioned it a couple times, just regular touching base, regular phone calls, being at the table. Important that is. And I remember when I was first brought into the funders and the county's conversations every week, I wrote them an email afterwards and said, I really appreciate the invite, and having a finger on that pulse, because they are the decision makers, much more so than little Kameron here, so being included builds that trust and that value.
I think just the daily and weekly touch points that we're doing. I get so many calls. Hey, can I jump on your call? And it's like, hey, man, we're all in this together, and not throwing up artificial walls and letting folks know that, hey, you're welcome to join the conversation. A lot of times they just want to know what's going on. They feel so isolated, and then I have my staff follow up with one-on-one phone calls. We call them touch points. That has meant so much to those folks that we actually reached out and called them and wanted to have a one-on-one conversation to follow up on this big global conversation that we had.
Danielle, I would offer that meeting people where they are is really important right now. So at She Factor, our market is young women that are just starting their lives, and we've learned that they have lots of different ways they want to communicate, whether it's a podcast or a virtual happy hour with drinks, very casual, or a formal presentation like a webinar, a book, an app. There's all these different ways we can connect with our networks, right? And we have to make them really robust and provide lots of opportunities for people to meet us where they are. And I think that's more important than ever right now.
Yeah, I think one thing initially I felt a lot of pressure the first couple of weeks, like people calling, what does everybody need? What does everybody need? And I just didn't have the answers, and I still don't have the answers. But the fact that I know that I can pick up the phone and it can go the other way and say, hey, here's a trend right now that we're seeing, and here's a need that needs to be addressed. I feel good about that. I feel like we have the network here and the systems here that I can do that when I see a pattern or something emerging.
Awesome. Well, my hope for our future of networks after learning from COVID-19 is, I think, really embodied in so much of what you all have brought today to the conversation, which is just the power of networks is really strong. The power in networks can also be very, very challenging. But I think that hopefully this, what we're experiencing is opening up innovation and ideas and experimentation. I would love to see private sector and government and nonprofit sectors come to the table in really new and innovative ways, and really just kick butt, getting all of this kind of shored up, hopefully pretty soon. So thank you to you all for joining today. It's been such a privilege to have you say yes and join us for this hour. I know that now we're going to go ahead and switch off and do a transition to our next panel, which are a series of short presentations on the problems really that are affecting work in these very small specific areas. So stay tuned, take a stretch break right now, listen to beautiful music from Andy. If you are so fortunate to find that link in our chat, you do not want to miss it. And thanks to everyone, and we will see you back in just a few.